Yep. Oh, shoot. Yes. Oh, yes. You're welcome. Sorry. What's that? No.
Yeah, I'll just wait for like a wave. Okay.
Did you get those back from the other round? Huh? Yeah. Okay. I'll take one. That's 4.
Hello. Hi, everyone. Welcome back to the main ballroom. If everyone could just settle into their seat, finish their sentence, their thought. So like I said, we are jumping right in to our first panel, and that does not involve me. I am just here to introduce our wonderful moderator who will then facilitate this conversation about Medicaid, SNAP, and their impact. So moderating our panel will be Indivar Dutta Gupta, an advisor to community change, a national organization that builds the power of low-income people, especially people of color, to create a multiracial democracy and a fair economy where everyone can thrive. Indy is also the founder and CEO of Blue Lotus Strategies, LLC, based in Washington, D.C. He is a recognized researcher, analyst, advocate, and policy influencer on U.S. economic policy. Additionally, Indy is a Doris Duke Distinguished Visiting Fellow at the McCourt School of Public Policy at Georgetown University, a fellow at the Roosevelt Institute, and a distinguished visiting fellow at the National Academy of Social Insurance. He frequently advises political candidates and campaigns on child, family, and economic policy, testifies before Congress, and speaks to the campaigns on and speaks to the media. His earlier work includes senior roles at the Center for Law and Social Policy, Georgetown Center on Poverty and Inequality, U.S. House of Representatives Ways and Means Committee, the Center on Budget and Policy Priorities, Friedman Consulting, as well as local work at DC Hunger Solutions. Another notable point on Indy's resume is he was a featured speaker at FCNL's 2017 Spring Lobby Weekend, where the focus was on protecting Medicaid and SNAP. Anyone here attended the FCNL 2017 Spring Lobby Weekend? Okay, I see some hands. Okay, there we go. He is one of the most brilliant advocates and strategists out there, and also exceptionally skilled at breaking down complex policies in really understandable ways. Thank goodness, because there's a lot of details to go over. So please, big round of applause for our moderator. And I will hand it off to you.
Thank you, Larissa. It is really great to be here with you all. I feel like we all need more time just with other people who share our values, and you all are doing really critical work. I used to work in Congress, and I know firsthand how consequential it is, who it is that members of Congress speak with. So I'm really, really grateful for you all being here, and I think on Tuesday you're going to go down to the Hill. So let me just kick things off by jumping right into the challenging situation we're facing. So Congress is in the midst of negotiating a large budget bill that could take away healthcare and nutrition assistance from potentially tens of millions of people. And if that wasn't bad enough on its own, it would be, and I kid you not, to fund tax cuts for very wealthy people and individuals, fund mass deportation and detention, and further militarization that could be destabilizing. So in this panel, though, we're going to just focus on the major health coverage and nutrition assistance challenges, particularly on Medicaid and SNAP. These are programs for families with low and moderate incomes, and we're going to focus a lot on the impacts throughout the country. We have two amazing speakers with us here today. I'm going to just introduce them both, and then we'll jump right in. There's going to be some time for questions also towards the end. So first we have Jamie Worker, who's Senior Director of Policy and Research at Carrying Across Generations, a national organization of family caregivers, care workers, disabled people, and aging adults working to transform the way we care in this country, and a real leader, especially in the fight to protect Medicaid right now. Jamie has been committed to ensuring equity in our public policies, and to make sure that leaders from communities who are most impacted by structural racism and oppression are collaborators in developing policy. Prior to joining the team at Carrying Across, she worked at the Economic Policy Institute, providing policy support to a national network of state policy and research organizations, advancing worker, racial, and gender justice. And she was previously part of the Policy and Legislative Department at Community Change, where I have a hat that I'm wearing today. And she worked on local and national racial and economic justice campaigns, focused on jobs and public investment in partnership with grassroots organizations. Now, Don Pierce is the National Director of Organizing and Community Empowerment at Hunger Free America, and a licensed practical nurse with over 34 years of experience. A survivor of hunger and poverty, she uses her lived experience to advocate for systemic change. She shared her story at Bread for the World's 2013 National Gathering and their 2016 Hunger Report, and on the 2016 White House panel on child hunger. In 2022, she was invited to and attended the White House Conference on Hunger, Nutrition, and Health. Dawn also serves on the boards of the Alliance to End Hunger Advisory Council and the Idaho Hunger Relief Task Force, and actively engages members of the Idaho legislature in Congress on issues of hunger and poverty. I'm particularly grateful because Don came here from Idaho today. Anyone else here from Idaho? There you go, you gotta represent Idaho. Thank you. Where, anyone? I don't think so. Maybe we'll get Montana. Washington. There you go. She's a longtime ally of the Idaho Food Bank, a former board member of Bread for the World, results experts on poverty cohort, and the Idaho Interfaith Roundtable Against Hunger. Her work is dedicated to ensuring no one struggles with the basic need for food, housing, or a living wage. So thank you both. First of all, thank you to both of our speakers who will really be answering your questions I'm going to pose and the questions you all pose as well. But let's just jump right in because when you all go to the Hill on Tuesday, you're going to be urging your members of Congress to oppose cuts to Medicaid and SNAP, the Supplemental Nutrition Assistance Program. You do not need to remember that. But Medicaid provides health coverage for more than 70 million people in this country. SNAP helps more than 40 million people afford groceries and put food on the table. So we're going to dig into those two programs and why they're important. So first, Jamie and Don, you both obviously work on healthcare and food security issues with an emphasis on advocacy. So tell us why you got into this work. We talked a little about this in your bio, Don. And why do you believe so strongly in it? Jamie, why don't you start us off?
Everyone.
You have to turn on that.
Thank you, Indy, already a very gracious MC. And thank you, so everybody, so much for being here. It's really, really wonderful to see you all. We've been doing this work both in DC and around the country, and it means so much that you're here. And I am here because care is something that connects us all, and Medicaid plays a really critical role in providing this care. One of the things that we say at Caring Across Generations is that care is something that connects us all, and each of us will have to either give or receive care at some point in our lives. And at the same time, care continues to be devalued in this country. And I got into this work through grassroots organizing, building power with communities so that we could determine what policies that impact our own lives should look like, what the institutions that serve us should look like, and so that our families and communities can thrive. And at the same time, we know that far too many people are really struggling with the cost of care in this country, even as the workers who are providing this care remain underpaid. And so the vast majority of workers who are working in the private sector or outside the federal government, more than 70% don't have access to paid family and medical leave through their employer, so that when folks need to take care of their own health or provide care for a loved one or welcome a new child. There's two of my children somewhere in this building. You might see them at some point. No one has to risk losing their own job to be able to provide that care. The U.S. is one of the only countries in the world that doesn't guarantee paid family and medical leave. And also, in the vast majority of states, childcare for an infant is more expensive than the cost of college tuition. And in every state, people pay more for childcare for 2 kids in center care than rent. A room in a nursing home can cost around $100,000 per year. And aging and disability care at home, where most people want to live and age with their friends and family and loved ones, can cost between $60,000 to $280,000 a year. And we know as a nation, we have actually more than enough resources to be able to make sure that everyone who needs that care can receive it. And Medicaid makes that a reality for so many families in every community in every part of this country. And so those are some of the things that have driven me to be here in this moment, and I'm really excited to dig in more with you all today.
Oh, I got it. So my name is Dawn Pierce. I am from Idaho. And I wanted to tell you that Idaho just rolled back our Medicaid expansion, which is very unfortunate. But I got into this work because I lived what you guys are going to be talking about on Capitol Hill. I have an experience with hunger and poverty. And through that, I've learned that I survived it and I won. Because I get to do things like this now, and I get to go to the Hill, and I get to lobby my local members in Idaho. But in 2010, I relied on SNAP to feed myself and my son, and it shaped how I saw the world. First, it shaped it in a way that was very sad and very doom and gloom. I faced ridicule at the grocery store. I faced, and not just from the checkers, I mean, from the other people in line. But, and it's, most of it was because of the foods I was purchasing. Fresh fruits and vegetables, you know, lean meats, things like that, cost a lot more than a can of chili and a packet of ramen. And so that's what we were eating. And my diabetes was out of control. My weight was out of control. I've been a nurse forever, but at one point I realized I got to stop doing this. And so, well, through diet and exercise, I lost a little weight. But the personal experience really opened my eyes to the connection between food insecurity and health. I've also learned that hunger is ground zero. You can't do anything. You can't get yourself up to go to the doctor if you're hungry. You can't get yourself up and go to school to learn. You can't get yourself up to go to work. My goodness, one time there was a potluck at work, and because I didn't have anything to bring, I called in sick instead of going to work. I lost that money that I needed to pay bills. No one should struggle just to eat. Eating and having food is a basic human need, and it is a basic right, at least food. You know, you can't protest. You guys can't go up to Capitol Hill if you're hungry today. You just won't feel good, and you just won't want to go. So that's why I feel that hunger is ground zero. Everything we do starts with and ends with hunger. Decisions made in Washington just don't balance budgets. They impact real families, real moms and dads with their kids at the table, wondering what they're going to eat. You can cut $100 million over so many years. That's fine. How does that affect Nancy's dinner tonight with her 3 children? What is she supposed to tell her kids when she doesn't have green beans for them because their SNAP was cut? Cutting SNAP means families face impossible choices between rent, medicine, and food. That's the reality. People actually have to make those decisions. I'll just take half a pill today because I can't afford the whole thing. Advocacy is about ensuring that those relying on SNAP, Medicaid, WIC, whatever it may be, have a seat at the table because decisions are often made without us and without them, and that's not okay.
I really appreciate you sharing that, Don. And I want to just note how important it is if you all have your own experiences with these challenges. If you feel comfortable, sharing them can really move members of Congress. I do this and I'm often described as an expert, but a lot of my expertise was coming to this country with almost no money, living where we couldn't afford furniture. We used boxes. I ate the same meal for meal after meal, potatoes, eggs. Fortunately, I still like potatoes and eggs, but that's all we could afford, right? And my father delivered pizzas, worked on a night shift in a hotel, so he was asleep when I was home. He was the only adult in the house. These stories are what can move people, in addition to obviously all the numbers. So if you feel comfortable sharing them, just know that they can really move folks. So thank you for sharing your stories. Why don't we talk a little about the actual programs? I'll come back to start with you, Don. But so these are 2 of the most consequential programs for essentially that basic foundation that Don was talking about, that everyone needs to be able to thrive, access opportunity. So we've got Medicaid and we've got SNAP. There's lots of other nutrition assistance programs that serve various needs, but if SNAP goes down, there's no way to make up for it. Let me just be clear about that. Deep cuts to SNAP cannot be compensated. There's no amount of charity. There's no amount of other programs stepping in. So I'm going to turn to Don to talk a little about SNAP and how it works, and some of you may be familiar with it from personal experience or otherwise. And then Jamie, I'd love to hear from you what you think folks need to know about Medicaid.
Thank you. So SNAP is called the Supplemental Nutrition Assistance Program, and no, you need, as he said, you don't need to remember that. It's the largest federal program designed to help low-income individuals and families access nutritious food. It provides a monthly benefit that is given to them on an EBT card, and It can be used to purchase food at grocery stores and online. There's some things that you can and can't purchase with SNAP. Of course, you can't purchase alcohol or cigarettes or batteries for your remote. But interesting things that I don't know a lot of people realize, with your SNAP card, you can actually purchase plants to grow food. You can go to the store and buy a tomato plant and use your SNAP. Or you can buy the seeds with your SNAP card because you're growing food. The amount that people receive actually depends on their income, their household size, expenses, of some various things. And I know in Idaho, the baseline SNAP benefit is $175. Right now, FRAC has actually been doing a SNAP challenge for the last 3 days to get people to see just how hard it is to live on $5 a day for your meal. SNAP is huge. It's with agriculture, as it should be. It should never be removed from the Farm Bill. It serves 40 million people. 1 out of 5 of those are children. Children who are going to lead this country. Children who are going to decide what they're going to do with their leaders in 20 years when it's time for them to go to a nursing home. I wonder how nice they're going to be. But SNAP is huge. I believe, if I recall, it's the biggest part of the Farm Bill. It takes up the most money, but it also helps the most people.
Done. Jamie, tell us a little about Medicaid and how it works.
So Medicaid is a great example of a program where you can say one thing about Medicaid and then I can say, wait, there's more. So maybe I'll say something and then you just say, wait, there's more, and I'll tell you. Okay, we'll try it out. So Medicaid is a critical health care program providing care for seniors, children, people with disabilities at any age, folks who are pregnant, provides care for childbirth and support for family caregivers, people who are working multiple jobs and struggling to make ends meet, but can't afford health care and don't receive health care through their employer. All right, so now it's your turn. Say, wait, there's more. Yes. Medicaid, not Medicare is, I'll say it one more time, Medicaid, not Medicare, is also the primary source of funding for aging and disability care, like in nursing homes, and also home care, aging and disability care in the home and community, where most people want to be able to live and age. And so this makes Medicaid critical to the well-being of millions of older adults and disabled people seeking to live and age with dignity and be with their loved ones. All right.
But wait, there's more.
Medicaid is also one of the largest funding sources for public schools. Medicaid school-based services cover things like speech and occupational therapy, mental health counseling, also specialized medical equipment, assistive communication devices that people might use in school, and also transportation services. But wait,
There's more.
Medicaid also covers supports for children with developmental delays or disabilities as early as possible, for early intervention services for infants and toddlers. But wait, schools and districts with fewer resources, including rural communities that serve higher percentages of Medicaid eligible students, would actually suffer the most harm from cuts in any form. So those are some of the things that Medicaid is a traditional healthcare program, but it also touches people's lives in so many other ways.
Thank you. Thank you, Jamie and Don. So you've given a pretty good sense, obviously, of how these programs work and why they're important. When you think about it from an individual's perspective, like Jamie, you talked about how workers don't have access to paid leave at very high rates, especially if they're low-paid workers. Or Don, you talked about the challenges of just sort of functioning in society without access to food. How do these programs really make a difference in people's lives? And Don, I'll let you jump in first.
Thank you. These programs provide SNAP, provides a vital lifeline for families. For example, a single mom working 2 jobs, barely covering rent and bills, But SNAP is there to provide with help with nutritious meals. So if you're getting $175 in SNAP, that's $175 that you can put to something else because it's not coming out of your budget. For seniors on a fixed income, SNAP helps cover the cost of food, especially with their high medical bills, which is where Medicaid would come in. These programs go beyond just filling stomachs. They provide stability and dignity, helping people focus on bettering their lives. Without SNAP, families would face impossible choices between food, rent, medicine, and these programs are more than safety nets. They are essential foundations for a stronger, healthier community.
So I think there's a lot of folks who probably have experience with Medicaid, but may not even know it. And one of the reasons that I think is a little bit intentional is because Medicaid is also called different things in different states. So anyone here from Connecticut? Connecticut. All right. So in Connecticut, it's instead of Medicaid, it's actually called Husky Care. Any Mainers in the room? All right. I know there's still folks in Washington State, but it's just called Medicaid in Washington State. In Maine, it's called Maine Care. In Oklahoma, Sooner Care. Wisconsin, Badger Care. California, Medi-Cal. So that's one. Medicaid does touch a lot of people's lives, but people may not know it because it's called something else. Are you from Minnesota? Do you have a? Oh, and I thought it was called Medicaid in Minnesota, but I will double check. Okay. That's a great question. So yeah, so that's one way that people might experience it that they might not be aware of because it's called something else. The program as a whole or the particular program that serves people with different specific types of disabilities. And I sort of learned about my own Medicaid story also later in life. Medicaid actually paid for my mom's pregnancy, my own childbirth, and also, provided health care when my dad and mom were both working multiple jobs, but didn't receive health insurance through their employer. And now I have 2 kids of my own, again, somewhere in this building, I have no idea where. And when our youngest was 2, and his teachers were concerned about his speech development, he was able to receive early intervention services for screening services that are supported by Medicaid. One other way it's touched my life, so unlike I didn't really get a chance to spend a lot of time with my own great-grandparents, but my 4-year-old and 7-year-old, they do. We recently celebrated the 100th birthday of my great-grandmother, their great-grandmother. She lives in Indiana with her youngest daughter, who's in her 60s, and she's able to live at home because of Medicaid. Medicaid actually pays for a care worker to also come to the home and provide meals, help her move around the home, and especially when my aunt, who's her primary family caregiver, is at work herself. And then another way that this program touches folks' lives is, through the workforce. Medicaid pays the wages of these direct care workers, like the one who comes to my kid's great-grandmother's house, who also, and in addition to their pay, also folks rely on it for their own health care as well. So at the end of the day, Medicaid means that kids and adults can see doctors when they're sick, rural hospitals can stay open, parents receive postpartum care. Medicaid means that people who are already underpaid and working multiple jobs and are struggling to make ends meet, they receive health insurance and are able to access affordable care.
Thank you. Wow. So first, so no one's worried. Jamie's kids are with an adult. For a second, even I was like, they're roaming around. Medicaid sounds pretty good. Agree. There you go. It sounds pretty good. So what are the sorts of arguments you might be hearing against it? Just one thing I will tell you all is that you might hear that supposedly Medicaid is inefficient or has waste, fraud, and abuse. It is objectively substantially more efficient than private health coverage. They do not spend as much money administering the program as private health insurance companies do. They spend a lot less time rejecting claims like private health insurance companies do. And they don't have to spend as much time marketing the program, although there's a very high participation rate actually in Medicaid among eligible folks. So I just wanted to note that because it sounds great, and you're probably going to hear some arguments to the contrary. Let me just jump now to the conversation around deservedness, right? So I love that sign back there. I'm sure everyone's seen it. Love thy neighbor, no exceptions. And people want to make exceptions here. And it's often based on some sense that, well, you know, in America, at least you should be working if taxpayers, which we all are going to help fund your health coverage. Or other ways by immigration status, maybe sort of slicing and dicing populations. So I'd love to hear from you both, and we could go to you first, Jamie, and then Don. But how do we shift that conversation around deservedness, right, to this idea that it's a fundamental right, as Don said, to have access to food? So I'd just love to hear from you both. You want to kick us off?
Yeah. So one, I think it's important to recognize these arguments for what they are, which is a distraction. The argument about waste, fraud, and abuse, and given everything that Indy said about how effective Medicaid is at delivering care for folks who need it, because part of the reality is that these cuts are being made in order to create savings for the federal government, and these are the largest piggy banks to draw from in order to pay for a very expensive tax plan that benefits the ultra rich. So that's part of it. And then I think beyond that, I think it's important to know that everyone deserves care. And I think speaking to your experience about folks in your life that have given or received care is a great way to address those narratives. And it's also I think some of these narratives also make it seem like it's very easy to access these services when they do have very strict eligibility requirements. And these are also a lot of the tools that are being used are also meant to create barriers that ultimately prevent people from receiving the care that they deserve. Yeah, those are some of the things that I would name.
So, sorry. Some of what happens with deserving. I was standing in line at the grocery store with my heaping grocery cart full of groceries. It was the last time that I was ever going to be needing SNAP because I'd gotten a job, I was working, everything was great. This woman in front of me was waiting for the person in front of her who also had a cart full of groceries. And typically, if it's around the first of the month, you know that a cart full of groceries means that someone is using SNAP. Don't ask. Just know and provide a little grace. This woman with a few things in her arms turned around and looked at me and said, at 1:30 in the afternoon on May 1st on a Sunday, I should have known better than to come to the store on the first of the month with all of these losers and their food stamps. Don't you feel the same? Now, I was paying with all of my groceries with SNAP. And the job I had gotten at that time was with the Attorney General's office in Idaho. So not only was I a taxpayer, but I had a job with the state. And a few choice word conversation happened. And also my son was with me and he had no clue that we were on SNAP, not a clue. And I started to walk away because I was not going to stand in line with this woman any longer. And all I remember about her is that she had on a yellow shirt. And as I walked away, As I was walking away, I said, I'm paying with all of this for SNAP, so you must think I'm quite a loser as well. And that's when I turned my card around. And she called out in front of my son and said, well, you don't look like you're on food stamps. And food stamps doesn't have a look. Any one of us could be on food stamps. The idea that some people are deserving of help and others aren't is very unfair. Everyone deserves enough to eat. In 2013, I was told that we have a divine mandate to give people something to eat. People deserve a place to live, and they deserve care when they need it. And we have to move on deserving versus undeserving. It is rhetoric, and it focuses on ensuring people's basic needs are not important. We must remember God's grace is for everyone, not just the people in society or a few billionaires who we deem as deserving.
Good. Thank you, Don. You can see how divisive this sort of rhetoric is in just our social fabric. So I'm going to turn to you, Jamie, first. But you both talked about how interconnected all these issues are. People obviously have a holistic set of needs. Not everyone, but some people who participate in one program might participate in the other. And there's other supports out there that are being cut left and right. Really, almost every day you hear about some attempt or some actual cut. So how do you sort of see all these needs relate to each other? Health, hunger, care?
I see all of these needs as things that can and should be a public good, something that each of us has a right to and belongs to all of us. And something that all of these different things allow our communities to thrive. And one of the other common threads that I see is that I think government has an important role to play in our lives and has huge impacts on our lives every day. And when these programs are well supported and they're delivered well, it also supports trust in government, which is part of a healthy democracy. And I think that's another connection that I see, that between all of these different services that really allow our communities to thrive, and when supported well, actually can create and strengthen our communities in so many different ways. And so I also see this attempt to cut services as another way to also erode trust in government. And instead of valuing communities in the way that they should be and making sure that folks have what they need.
Thank you, Jamie. Don?
While I do not align with the politics of my state, the politics of my state align with the current administration. On Thursday, our governor signed the bill that rolled back Medicaid expansion. On Tuesday, our state Senate argued restricting SNAP purchases. So they don't want to allow candy and they don't want to allow soda. And I'll tell you what, 132,000 people getting $175 a month, they are not the problem. SNAP and Medicaid are so intertwined. It's insane. Medicaid expansion was rolled back in Idaho because of the exploding use and the exploding cost. And they attributed that to SNAP recipients. And they instituted our expanded Medicaid in January of 2020. So they don't even have a realistic idea of what Medicaid expansion looks like in Idaho because all of the numbers they have are from a pandemic. Wow, Medicaid and SNAP are like twins. And I would say that most of the people on SNAP receive Medicaid. I would say most of the people on SNAP do work. People on Medicaid do work. We're a country that's getting sicker because the government doesn't want to help. We are a country that is getting hungrier because the government doesn't want to help. We cannot free clinic and food bank our way out of hunger and bad health.
Thank you, Don. And I'll just add, in the case of SNAP, for example, we did a number of things in the pandemic on a temporary basis. Like we found that over the course of the school year, kids routinely experience more hunger in the summer. Does anyone have a sense of why that might be? Go ahead, just shout it out. Yeah, that's right. School meals. And so we did things like a summer EBT program, and we saw basically for the first time since we've been recording, summer hunger fell. What did we do with Medicaid? We said, we're going to, once you're on Medicaid during the pandemic, we're going to basically freeze your eligibility so you can't get kicked off. And they're going to do a lot of things like that now in reverse. They're going to say, you got to recertify all the time. And here's the thing, Don hit on this a bit, but also Jamie, when she talked about her parents, the United States has chosen a path of low wage jobs. And what do I mean by that? Among, I think, 36 peer countries, middle to high income countries, United States ranks towards the bottom, around 34 out of 36, in having the highest share of jobs that are low paid, below 60% of median. So we have both chosen a path, by and large to date, there are obviously exceptions, of low wage jobs that don't pay people enough. They often don't come with fringe benefits like health coverage. And then we don't provide those benefits as a country. So in some ways it's unfortunate, but these programs actually support work, and their work supports in the sense that a very large share of people who are not elderly, who are not with disabilities, who are not children, are working, as you've said. So keep that in mind in your conversations going forward. Let's jump a little bit more to what the actual policies are that we're sort of up against, that are being considered. And I'll start with just Jamie, if you could talk a little about the structure sort of Medicaid, how do the federal and state governments sort of relate? And then Don, if you could talk a little about how money flows through SNAP to places like Idaho.
So I talked about some of the family relationships that can also be interdependent and kind of define how Medicaid work, like for family caregivers and folks receiving services like older adults and people with disabilities. Medicaid, the relationship that Medicaid has between federal and state governments is also very much an interdependent relationship. And so Medicaid is administered as a partnership between the state and federal government. And so 2/3 of Medicaid dollars come from the federal government. And Medicaid is actually the largest source of federal funding for states. It makes up nearly 1/3, if not more, of most state budgets. And states are, generally required to balance their budgets, right? So if there's reductions in funding for Medicaid, that also puts states, so it's not like the savings that the federal government creates just disappears, right? The costs are actually shifted onto states. And so this puts states under significant financial pressure across all areas of goods and services that they provide. And it means that these cuts to federal dollars would cut services or reduce benefits, limit eligibility, and also decrease payments to the providers who are providing the services. And often, sometimes the main employer, you think about a hospital, sometimes the most significant employer in a community can be a hospital. And because states don't have room in their budgets to make up for these massive gaps, this would really, harm families and leave ultimately folks without the support that they need. And then I want to add one more thing about home and community-based care and aging and disability care in particular, because unlike nursing home care or institutional care, nursing home care is considered a required service of Medicaid that states are required to provide. And so in order to receive their share, any share of their federal dollars. But what is considered optional under federal law are home and community-based care, the care that allows children who are extremely might have very intensive medical needs. It makes a difference between them spending their life in an institution to get that 24-hour care, or having a worker come to their home or support a family member to provide that care themselves. And so because these services, while they are essential but are considered optional by the federal government, these would be some of the first services that would be cut if states are have to make hard choices about receiving the remaining amount of federal dollars that they have left.
I really appreciate you bringing up that example, Jamie, because I often think about how these programs really support families, keep families together, and of course support communities. You mentioned even the role of providers in healthcare and communities. So I want to come back to that later, but Don, why don't you tell us a little about sort of what's the sort of high level of what people need to know about how SNAP works? And with Medicaid, just to make clear to folks, when we talk about things like government shutdowns and whatnot, that can affect the funding for the staffing of the program, but the program is automatically funded in the sense that people can rely upon the fund, at least until now, they've been able to rely upon the funding, and SNAP is sort of similar.
It is. Thank you. So this is a very critical time for SNAP and Medicaid. Typically, programs like SNAP, Medicaid, WIC are the first ones on the chopping block because many on the Hill think that people are just sitting around and trying to defraud everybody and, sit around eating bonbons instead of getting a job. But that's not true. So SNAP is a federal entitlement program. And I've learned to really dislike that word, entitlement. And there's eligibility requirements. You make a certain amount above or below, your job, your bills, your rent, things like that. But the changes that are proposed, you can block grant SNAP, and that means that instead of just giving the states money, that means that you get $1 million, do what you want with it, which really leaves a lot of people out.
What could go wrong? What could go
wrong?
wrong?
What could go wrong? Exactly. Yeah, you're exactly right. But as Congress decides, so SNAP, you get your SNAP card, you go to the store, you buy your groceries, and for every dollar, and I wish politicians would realize this, because everything's about money. I get it. The country has to pay its bills as well. But for every dollar that you go to the store and you buy something for $1 and you scan your card, that generates $1.80 into the community. And it's just money for the government. It's like revenue. It's like, there you go. Here's $1.80. And so you would think that they would enjoy that. One thing, a side note about summer EBT, I worked last year to get this passed in Idaho, and it lost by 3 votes. But a lot of what they were saying is, we don't want to create a welfare state. Done with that. But so SNAP and the Farm Bill and all of that stuff, it not only deals with the food programs, but it also covers tax policy, immigration, climate, and Pentagon spending. And social programs like SNAP face cuts in order to fund other things because they don't want to print more money. So we're going to take from SNAP and give it over here. And we're going to take from Medicaid and give it over here. Everybody will be fine. What could go wrong? But SNAP and Medicaid are vital to this country. They are vital to keeping people working because the people using these programs are the working poor. Minimum wage in Idaho is $7.25 an hour. People actually make that. Sorry, this was my life. But with hungry tummies at bedtime, we need to ask ourselves, should we prioritize SNAP tax cuts for the wealthy? Or should we beef up our military? Or should we provide food and assistance for our families? This SNAP cuts weaken families, and they weaken them when they need it the most. Do no harm applies to every aspect of our lives and to every person that needs help.
Thank you. Let me actually jump off of what Don just said and add a little bit of context. So the House has passed a budget resolution that calls for cuts over 10 years of at least $230 billion with a B in the SNAP program, essentially, and $880 billion effectively in the Medicaid program. Those seem like very large numbers. None of us have that kind of money, but we need to put that in context. Does anyone have a sense of how much the value is of U.S. economic activity in every year? Go ahead.
This might be a ballpark, but $200 trillion.
It's nearly $30 trillion. It was a little over $29 trillion of GDP just in Q4, the last quarter of last year. So when we're talking about, that's in 1 year. That's in 1 year. Okay, so what he said was right over 10 years or so. Okay, so we're looking at over $300 trillion over 10 years. So can we afford Medicaid and SNAP? Unquestionably. So why would they go after these two programs? And here's the basic math that Jamie alluded to earlier. So there are a few $1 trillion, depending on how you count it, $4.5 trillion of tax cuts that the current Congress majorities and the White House want to move forward. $4.5 trillion over 10 years. Okay, so what does the United States mostly spend its money on? The federal government.
Military.
Yeah, so Social Security and defense and health coverage. Okay, Social Security, health coverage, and defense. Social Security, that includes retirement, disability, survivor's benefits, and that is self-financing. So no matter what the richest person on the earth says, that is self-financing. That does mean that at some point there could be benefit cuts if not enough revenues coming in. One of the reasons why less revenue has come in to fund Social Security directly is because of inequality, and we don't fully tax the incomes of all of folks with higher incomes. But that is a huge part of the federal budget. Then you've got health coverage, including Medicare for mostly seniors and some folks with disabilities. And you've got Medicaid, including its sibling program, CHIP, Children's Health Insurance Program. And then you've got defense. So just for perspective, this $880 billion in Medicaid cuts over 10 years, that would be the equivalent of cutting our defense spending over 10 years by 10%. That's all you'd have to do. You would just cut defense spending by about 10%, and you wouldn't have to touch Medicaid in this scenario. And the only reason why they're even going after these programs is that the president has said he does not want to go after Medicare and Social Security, at least not directly. And thus what's left is programs for folks with low and moderate incomes. Essentially, that's what's left on the table. So when we talk about how important it is, especially if you have been impacted and you look at the work and careers of Don and Jamie, that your voice is heard. This is why. Because they're not spending time with folks who are participating in Medicaid or SNAP necessarily, or at least they don't know. Sometimes it's stigmatized. But having worked in Congress and having advised folks who are running for the presidency and other high office, it's unfortunately all too frequent that the people with the lowest incomes that they know are their staff. And they are routinely in the top 1.1%. If they weren't when they got into office, they often are by the time they leave, which is a whole other conversation. But so this is the broad context. There is really no need to go after these programs, but they want to pass massive tax cuts, overwhelmingly helping the very wealthiest people in this country. And they want to pay for part of them so it doesn't look like they're increasing the deficit and increasing national debt as much as they would be otherwise. So keeping that in mind, Don, you said a bit. If you want to add more on this sort of broader context, please do. And then Jamie, I'd love to hear how you're sort of thinking about all this, especially in the context of the US spending more than I think it's still the next 4 countries combined on military spending.
Yeah, and another piece of it too is that, it actually costs a lot of money to separate immigrant families and put them in detention and take them away from their homes and communities and send them to, back to other countries. And so that is what's at stake when that's what we're talking about in terms of choices. We're talking about taking away critical programs that families rely on in order to pay for more defense spending and for the current administration's deportation agenda and mass deportation and detention agenda. And so I think it's so central to keep in mind, because that's not what we're going to hear when you're in different offices in DC. A lot of the emphasis will be on what we've mentioned, trying to say that, well, not everyone really needs, SNAP. Not everyone really needs Medicaid, but you see how much these programs impact people's lives, folks who are already struggling. And there is no way to get to the scale and scope of the cuts that are being proposed without harming families, without harming the people that rely on these services. There's no way to carve out specific communities and folks who are already struggling from the types of cuts that are being named. So that's, I think, important to name, no matter how some of these cuts are being disguised, whether they're called work reporting requirements, whether they're called block grants or per capita caps. All of these are tools intended to create savings so that these resources can be used to increase spending on things like defense and the mass deportation and detentions.
Cuts for billionaires.
And tax cuts for billionaires, yes.
Which they definitely don't need.
So I've often thought about defense spending as get a $20 bill and light it on fire. That's how I look at defense spending, because you're building bombs and planes to drop the bombs and you're lighting your money on fire. But wow, $1 trillion, that's a lot of money. It doesn't even seem like it's a real amount of money. I mean, is money even real? $80 billion. What does that mean over 10 years? The people that you guys are speaking for and on their behalf, they don't care about $1 billion or $1 trillion over a 10-year period to reduce this and do this and give this to them and this tax cut for this person. They don't care. I didn't care. I wanted to know, how is that going to affect my son and myself tonight? I don't care what it's doing in 10 years. I want to know what it's doing for me right now.
Thank you. All right. Well, I think we can actually go a little early to Q&A. There's at least one mic back there, 2 mics. So if folks have questions, just raise your hand and we'll go here first. And maybe just introduce yourself and
Hello.
question.
My name is Kate West. I am from Concord, New Hampshire. I'm here with Advocacy Corps. I guess going back to thinking about people that deserve these programs, right? We're talking about folks that might be disabled and need to be taken care of and can't work or have worked and paid into the system. Immigrants who consistently pay in and contribute and bolster our economies and make sure that we're able to get the food that we need and to like survive and thrive within our communities. Single parents who take care of their children, caregiving is a job. And so when we think about deservedness, it really, one of the things that has continued to jump out at me is, we have a history of the government subsidizing big corporations, the auto industry, right? We can use American taxpayer money to subsidize these like giant entities, but there's always pushback when it comes to investing in American people and in working people. And I think of what it sounds like is you get this pushback of the taxpayer dollars subsidizing the life of the individual who needs SNAP benefits to eat or who needs Medicaid to pay for healthcare. But I'd like to say that what I'm hearing is that what it really is that we're asking for the working people to use their tax dollars to subsidize the employers for not making sure that they are paying for like the labor, right? Paying what people really deserve. Because if you're working 40 hours, or in my case, sometimes 60 hours a week, you should be able to pay for food or rent and things like that. So, yeah. So I guess that's really the question, is how to clearly make it very clear that, it's not that personal responsibility. It is a failure of the system. People are doing exactly what they should be doing, and they're not getting what they deserve.
Yeah, so I know in my world we often say that poverty is a policy choice, which is, as you've described well, absolutely true. Poverty rises and falls not with any set of individual decisions that people make, but with the choices of policymakers. Those are the individuals who aren't showing personal responsibility, in my view. But what would you say about how we can either tell that story or make clear that the whole point of a functioning economy is to help people. The point is not for people to support an economy.
Yeah, so I think there's lots of evidence that can highlight this, and a lot of which that Kate already alluded to. And one of the things that stands out to me is, as a takeaway, is that we actually need more care, not less, and more support for services like SNAP and Medicaid, not less. And in most states, many states, there are waiting lists of thousands of people who are waiting for home and community-based care. And folks are often there. These are not services that people can wait years for often, but they may, if they even are able to access the care that they need, it's because they've waited for 3 years, if they even know that there's a waiting list to be on. And so I think that the value of that care is so critical, and it doesn't just disappear. It's actually care, it's taken on by family caregivers. It's taken on by people who are struggling with the cost of care. And so, yeah, those are some of the things that I would highlight there.
Want to add anything, Don? And then we'll get another question ready.
So
Okay, thank you so much.
I can tell you the theory behind it, behind investing in corporations and not in community and in the individuals, is you invest in the corporation will invest in the individual and their communities. That doesn't happen. That hasn't worked since 1980. You guys are going to be the biggest changers out there. I think you guys out here are our future. You guys are going to save us. You're going to hear a lot about,
Sure.
Yeah, no pressure. But you guys are going to hear about the fraud. Fraud is less than 1%. What's 1% of 40 million? Not a lot. But the whole thing about the rich do get richer and the poor do get poorer. And we are marginalized as the working poor. And that is so unfortunate. But to be able to speak about issues, you're going to get tons of pushback if you're from a red state and that's where you're going. But just remember who you're talking to, remember who you're talking about, and remember who you're fighting for.
More questions?
Hi, my name is Bailey. I'm with Agnes Scott College from Georgia.
Georgia.
Yes.
How about Georgia?
Okay, so this has given me a lot to think about, and I do have a lot of questions, but I'm only going to limit it to two. First question, we were prepared to come here and talk to legislators, not just to voice a problem, but also to come with a solution so that way we can give people other things to think about. So to my understanding, these programs are like stepping stones for people who are underprivileged. So they'll be on it until they won't have to be anymore. First question is to debate the argument around fraud and everything. What will it take to get people off of these programs? Like, what can we do to get people off of these programs? And then the second question really is just to get into the mind of a Republican. For the most part, I'm a psychology major, so it's just kind of what I do. But, and this may sound like a really silly question, but I really just don't get it. What does providing tax cuts do for the country? I don't get it.
I can do the first one quickly if you guys, the last point on tax cuts, you can take the two on the stepping stone. And just one quick thing, when the 2017 Trump tax cuts were enacted, that's the individual provisions there are what are up for expiration this year. That's what's sort of forcing action right now. Just to be clear, no Democrat supported it in the House or Senate, and 12 Republicans actually defected and opposed it in 2017. So they had a bigger margin. They could not afford such defections. They couldn't afford 2 defections today. So just for perspective, well, 3, I don't know. There's some member of Congress passed 2 passed away, I guess. But I say that just because it's not necessarily purely partisan. And that was even without Medicaid and SNAP cuts, which are creating a lot of heartburn for good reason among some Republicans. So what is it that the tax cuts do? By and large, very little. But obviously the theory is that it stimulates more private economic activity and thus living standards rise. But Don said this, I would argue since 1973, as our economy has grown, living standards have not grown for people as much from the bottom through almost near the top. So basically at the end of World War II to 1973, if you look at people who are at the 10th percentile of income, 20th, 30th, 40th, 50th, 67th, 90th percentile of income, from that post-World War II period to 1973, they all grew the same percentage. And then it broke apart. And you can see that the middle and bottom kind of petered on some modest growth, not much, and the top ran away with a lot of the gains. And almost certainly some of that is because of tax cuts. So they will say it will grow the economy. I don't know what the point is if all the gains go to people at the top. And also they're gutting things to address major national needs, like how many of you all care about the climate crisis? There is no amount of private economic activity through tax cuts or otherwise that's going to address and solve the climate crisis. It's impossible. And actually, you would learn that in Econ 101 that because of the nature of the crisis, that just wouldn't happen. So that's the short answer. But I think just look, this is about human beings and people. And I'll let them answer the question about the stepping stone. But we should care for people, whether or not it's an investment. It just so happens that in many cases here, you actually have a positive return on investment, save money. SNAP almost certainly pays for itself. Housing assistance almost certainly pays for itself. huge chunks of Medicaid. Medicaid for kids improves their high school achievement and graduation rates. So all these things happen to often be investments, even if you just don't have the decency to care for each other.
So Congress typically wants to cut Medicaid and SNAP to save money, but what they're actually doing is spending more money, because by cutting these programs, people are going to be sicker, people are going to be hungrier, people are going to be calling in sick, and they're not going to be getting paid, and then they're not going to stimulate the economy. Cutting these programs costs more than they feel that it saves. If anybody wants to learn how to talk conservative, I got you. I come from a very red state. I don't align with those politics, but I can certainly talk it. I can give you talking points. Everything conservative is about money. It's not corporate welfare. It's capitalism at its best. It's, things like that. So I got you. Just come see me. But I've never understood trickle down. I've never understood why you want to cut people and then spend more to take care of them later on when they're in the hospital. They haven't worked for 2 months, and then they're going to apply for Medicaid anyway. People being kept sicker because of SNAP cuts. You're not eating, your diabetes is out of control, you have heart failure, and so then you're not getting the food you need, and so then you're right back on Medicaid. My story is I was on SNAP for 17 months. That was it. January 10th of 2010 to, well, my last disbursement was on May of 2011. But without being on SNAP for that short time, I would not be sitting right here today. I wouldn't. I have no clue what I'd be doing. Probably, still supervising in some long-term care facility on the night shift. But because of SNAP, you'd be amazed at how many members of Congress were raised on SNAP. Or, yeah, my mom was on Medicaid. Or after I was born, my mom got WIC. But without SNAP, a lot of members of Congress wouldn't be where they are today. I know I wouldn't be sitting in this very seat without SNAP.
Sure. Yeah. So Georgia is such a great example for why we need to invest more in care and not less. Georgia is actually the only state in the country right now that currently has work requirements for Medicaid. And Don was talking about how it actually costs more, not less, for the administration of implementing work requirements in Georgia alone. I'm talking administrative costs, not actual care that people receive. It costs $40 million in its first year of the program. And so the money is being spent, but it is being spent in ways that don't help people, actually prevent people from accessing the program, and is on consultants that administer these work reporting requirements. And then I think the other thing to really add and emphasize too is that Medicaid creates jobs. It pays for local hospitals to provide services. It pays our as a whole. We are growing older as a country. At any time, at any age, people can develop a disability, and they may be still able to go to work, but maybe they need someone who can help them with transportation to get them to work because they use a wheelchair. There are all sorts of ways that Medicaid and SNAP, they support our local economies and allow people to thrive, and that's no different in any state that we're in.
We'll get the mic around for more questions. Just one quick bit on the stepping stone, just to add. If we really want people to not have to rely on Medicaid in particular, but also SNAP, we have to create a lot more good jobs. And that can be through unions, that can be through labor standards. But right now, basically, people are trying to have have their cake and eat it too. So there's just no path forward without those changes in the labor market. Do we have somebody ready? We have a lot of people ready.
A
Being
question
voted over there.
first for Indy. How do tariffs help with affordability and sort of meeting our deficit?
Quickly, how do tariffs help with affordability and meeting our deficit? Not much, probably in the wrong way on affordability. Look, there's always tariffs. We have tariffs, both parties have tariffs. They're usually targeted, they're usually very focused. They can even sometimes be done in ways to protect labor standards, environmental safeguards, human rights. That's just not what's going on. I mean, you don't go after Canada if that's what you care about. That will only raise prices and reduce income. So it's actually both sides. And deficits, you will hear that these tariffs will help close deficits. They're just a tiny sliver of the size of the deficits and can't even remotely make up for the tax cuts that are being pushed forward.
And the question I had for all of you, how do we help legislators care more about constituents like us than corporations?
Tell your story. Every single one of you out here has a story. You may not even realize it, but maybe you don't know that your family was on Medicaid like when you were born. Maybe you don't know that your mom was utilized WIC. Dads can also get WIC. I don't think a lot of people realize that. Grandparents can get WIC for their kids under 5. But you have to be louder with your real stories, with stories from people. I mean, you can't tell their story, but you can say, hey, I know of someone. I mean, you certainly wouldn't be able to tell my story, but always tell those stories. Never let up on them. Never, ever give up. Never take no for an answer, and make them promise you something before you leave. Always talk about my brother's nephew's cousin or something, because corporations, yeah, they have big money and they donate lots to campaigns, and your so-and-so's in whatever Exxon's pocket. But you guys are going to be louder, and you are going to hold them to what they say. If they do something that is totally contrary to what you would like, you need to tell them politely. But yeah, hold their feet
work,
to
maybe not so politely, but
hold their feet to the fire and never, ever, ever give up.
The good news is that we've actually done this before, right? In 2017, we prevented the repeal of the Affordable Care Act successfully. And earlier, we also prevented Social Security from being privatized before that. And it's because folks like you have been working hard back home and in DC. And Indy also alluded to, I forgot what I was going to say. Come back to me.
Yeah, well,
Okay.
Thinking about it, I'm really impressed by the organizing over there. So I wonder if we could get a mic to them. But yeah, just jump in if it comes back to you. All right, you all are ready.
My name is Luke. I'm with the University of Mount Union. Beyond the moral imperative to make sure that people have access to food and healthcare, I think that both sides of the aisle would agree that the ultimate goal of means-tested welfare programs is to ensure that people have the opportunity to put themselves in a position for long-term financial self-sustainability. But one of the biggest problems that we see is that as people progress through different income levels, the offset and benefits when they leave programs ends up putting them in a worse off position than when they entered them. Like the effective marginal tax rate for low and moderate income people is right around 30%, which is as high as it is for the wealthiest people in our country. So what can we do to make sure that these generational cyclical cycles of poverty, what can we do to overcome those, to make sure that the benefits that people receive are more proportionate to their income levels?
Great question. Luke, was it?
Yeah.
And maybe Jamie, you can talk about this since Of course, it'd be nice if people didn't lose health coverage once their incomes moved up or down. And Don, to SNAP has specific policies, fortunately ones that the administration are coming after, that help people as their income rises stay on the program.
Yeah, so some states are eliminating. Sometimes in some states you have to have. They limit the amount of assets that you can have. So everything that's not in your bank account. So could be even like the cost of a car, something like that. Some states are eliminating those kinds of requirements so that if you have a other qualification based on income or need, you're able to access that care. In other states, in Washington State, for example, there's a social insurance program called Walk Cares, so that if folks do have a disability later in life or need to care for a family member, they pay into a program and become eligible and access that care. They are able to do so. And then the last point that I would make is that India alluded earlier to, how defense spending is often off the table, and things like Social Security and Medicare have been named as things that are programs that will certainly not be cut directly. And earlier we got a question about how do we make sure that these programs are considered more important than corporations, and the people that they serve are considered more important than corporations. Right now, it's politically toxic to make cuts to Medicare, to make cuts to Social Security, and to try to attempt to make any demands on cuts to defense spending. This is our opportunity to make cuts to Medicaid and cuts to SNAP politically toxic, so that they will never again come back for these programs. And so that's the opportunity that we have, that we've done in the past because of the work that we've done related to Social Security and Medicare. And we can do it again like we did in 2017, and we can make sure that it's not ever a possibility again.
Amy, and very specifically also with Medicaid, especially the Medicaid expansion, to get at that question, right? That Medicaid expansion, which the Supreme Court deemed optional, but originally was not designed that way in the Affordable Care Act, that basically eliminates this risk of your income rises too much and you can't have, you don't have access to health coverage, because low-paid jobs almost never come with real access to meaningful health coverage. So that Medicaid, if states expand it, actually gets rid of that problem that you're describing in that one sense, and health coverage is where it's sort of the biggest problem, these sort of cliffs, benefit cliffs. So you see what Idaho did, and they actually just made the problem worse. And SNAP has similar policies.
Actually, and Idaho just also enacted work requirements for Medicaid. Governor signed it this week. So the difference between rich people and poor people owe, rich people own. And I have a plan for that. But you hear about people who apply for SNAP. Nope, I didn't get it. I made $5 too much. How ridiculous is that? My aunt, elderly, applied for Medicaid, simple application. She made $6 too much. She doesn't even work. She's retired. And I think it's the system sometimes is designed to keep people poor and keep them sad and keep them dependent. Because if you make this much money, you have to report if you've made over $50, and that could throw you off of your benefits. So some people are just like, oh, I'm going to stay at my $7.25 an hour instead of taking this, $28 an hour Chobani pays, base pay. But they don't take that because the money that they're going to make is not going to make up for what they've lost in SNAP or Medicaid.
I'll defer to whoever has a mic and get somewhere first. Maybe this side, though, this time.
Okay. Do you want to ask a question, both of you? Oh my gosh. He's had
So hey, my name is Logan, and I'm a junior from Western International School in Pennsylvania, and I have a question about the spending on national defense. You mentioned that if we have a 10% cut on the national defense, it would actually help us to support the Medicaid and also the SNAP. Like, I'm curious about like what are the potential reasons why the government is not taking that cut, and as a constituent, how are we supposed to like speak or persuade the senators like to take that cut and make that step?
We're all going, I don't want to do this one. That was a really good question. Wow, how do you convince a member of Congress not to build a bomb? That's tough. I'm going to let Indy take this one.
But then you all will get your final thoughts in. We're down to our last 5 minutes, but look, not everyone is persuadable, but as we found, both with blocking, when George W. Bush was president, Social Security privatization, blocking the repeal of the Affordable Care Act, thanks to a final vote by then Senator John McCain, that these are winnable fights, and some people are persuadable, and if they're not, you can make people pay, obviously, at the ballot box. So that's something to keep in mind. There are strategic losses in policy where you can still achieve a goal, even if you sort of technically lose. So how do you persuade folks who might be persuadable? Some of it is about who's in their district. So there's an article now, I think, in the New York Times about a pretty conservative area in Alabama, but they have numerous federal agencies and a huge chunk of federal workers there, from NASA, a military base, and so on. And there's a huge uproar among people who don't identify at all as progressive or left of center, saying, why is there no congressional oversight? Why isn't Congress doing its job? This is really harming us. We're all anxious. We don't know if we're going to be next. And similarly, there's a number of districts, congressional districts. I'm not sure. I assume you all will be visiting your districts. That's sort of home in some meaningful sense. But there's a number of districts that may overlap where there's a real case to be made that the economy, if you didn't care about the sort of just either morality or just the decency of individual folks, the economy will falter. Rural hospitals depend heavily on Medicaid. They provide enormous amounts of uncompensated care, so do other hospitals, but particularly rural hospitals will close. I can guarantee that. If there are significant cuts to Medicaid, they will close. And so you can make an economic argument, you can make a political argument about the numbers of people who's affected, mobilizing them. And you can also draw contrast. Contrast can be very compelling. This should not be hard because the path that they're going forward with now isn't just Medicaid and SNAP cuts and cuts of student loans, by the way, and other things like that, student affordability, but it's also trillions of dollars in tax cuts to the very wealthiest people who just absolutely do not need it. So the contrast, making very clear that you're aware of it, that you see it that way, can also make people feel, frankly, a little gross about what they're doing, and they should.
So in 2017, we had the thumbs down from John McCain. Folks remember saying, no to the repeal of the Affordable Care Act. You can imagine that even though there was only one Republican who put their thumb down, that there were probably other Republicans hiding behind that one thumbs down, right? And so when we are going into offices and meeting with folks with their constituents, we want, if it's a Republican office, we want to not including, we want to emphasize the impacts at the district level. We also want to be able to elevate the tension in the room. I'm a middle child, so I'm really comfortable with conflict. And healthy conflict, because I think it can help us to get to a better place at the end of the day when we're able to engage and disagree with each other and have discussions about it. But you can elevate the tension in the room by sharing the story of people who are impacted by these cuts. And you can ask, even if that member is not willing to publicly oppose. We actually don't, because of how narrow, how slim the majorities are in the House in particular, we actually don't need everybody to come out and oppose. We just need a few folks to come out and oppose. And so even if they are not willing, or you can, if you're talking to staff, you can say, if your boss isn't willing to come out in opposition, would they be willing to talk to their colleagues about in the Republican caucus or the Democratic caucus about how important these programs are to their district? That's an ask that you can make. I think it's important for Democratic offices, especially, to be very even more vocal about how critical these programs are in back home and in DC. There's many ways that folks can do that. You can offer to write an op-ed with them. You can offer to do an event with them when they're back home. And so all of these different ways, I think, get at your question of how we move people and eventually encourage people to be champions and actually, vote to make sure that we all have the care that we need and deserve. Because the reality is that care is really fundamental to who we are as a society in every aspect of our lives. It's not just a personal issue to be able to access care, including Medicaid, but it's also a shared responsibility that we have, and an experience that connects all of us. We need more investment in Medicaid, not less. And there's never been more at stake for Medicaid. And there's also never been a better time to win. And that's what we can do. So that's
Thank you, Jamie. Don, any final?
So I'm an oldest child and I have no problem starting conflict.
Jamie didn't say starting conflict.
No, I'll start it. She can join in. But constructive or otherwise. So the decisions made in Washington often affect real human people, everyone. People who are working hard to make ends meet. Programs like SNAP are lifelines, and we cannot afford to lose them. Any budget bill is a chance to prioritize what really matters to us and what should matter as a country, ensuring everyone has access to food, housing, healthcare, and lifting those up who are the most vulnerable and not keeping them down. As we move forward, we must remember our moral responsibility to help the least and the last of our brothers and sisters and those who are overlooked and forgotten. What kind of society do I want to be? One that leaves people behind, or one that ensures no one goes hungry? No one gets left behind, no one gets left out, and everyone has a chance to thrive. So let's make the right choice and stand together to support the most vulnerable among us.
Thank you. And I get to close. I'm so sorry there's so many more questions. Maybe a few of us can hang out. If you all don't know Amelia, or maybe you know Amelia, she can get you my information at least if you have follow-up questions, although she probably has actually all the answers. But let me just thank you all. Remind you, you have a lot more power than you realize. It is hard to feel that way, especially right now, but especially together, you really do. You are going to be doing something really important. You don't need to be intimidated. You don't need to be afraid. You are already leaders, so it's not just about the future. The most important thing is I get to tell you, you have a 30-minute break. So you now have until 4, well, not quite 30 minutes, but until 4 o'clock. So thank you. And thank you to Jamie and Don.